guys, it's Dr. Sammy Pryor, and I'm continuing with the Plastics and Your Health series. Okay, guys, you need to watch this whole series. You'll learn something in every one of them. And we're going to continue with these phthalates because phthalates interfere with other things that I didn't mention in the last video, but you need to watch the last video because that talks about more on how you're exposed to these things, okay, and how to stop the exposure. So this video is just going to talk about the ways it interferes with energy in the body. And I recommend any patient who has chronic fatigue syndrome, fibromyalgia, ALS, amyotrophic lateral sclerosis, or any of the neurodegenerative diseases, congestive heart failure, just anyone with fatigue that they cannot shake. These are all people that would benefit from running two tests, one that will tell us how much phthalates you have in the body, and the other will tell you how your energy pathways are running. So I am accepting patients. You can reach out. Yeah, so with these phthalates, and this is what got me to make this series because this contributed to one of my patients passing away, and oh man, I was so sad when that happened, and it just infuriated me because as a naturopathic doctor, we want to get the garbage out of the body. That's our philosophy, and this is garbage, okay? Many people are exposed to phthalates. Women have the most exposure. Yeah, but you'll learn about that in the other video. So basically how they interfere in the body. So first thing, they block the conversion of the interconversion between pyruvate and lactate, okay? Lactate is made anytime you have a low energy or low oxygen situation, and the mitochondria is not able to keep up with energy demands. But once that lactate is made, you need to be able to convert it back to pyruvate, and if you have too much phthalates, you can't do that. And so this phthalates can build up, and you can have a lot of problems with getting that pyruvate back, and the pyruvate feeds right into the high energy pathways such as the tricyclic acid cycle or Krebs cycle, okay? Yeah, so we need to know about the phthalates for that. The second way it blocks energy is because it inhibits beta-oxidation. And what is beta-oxidation? Basically, you have adipocytes or fat cells that store fat, right? Anytime you're in a fasting state, so that could be overnight, intermittent fasting, yeah, anytime you just forgot to eat and you've gone a long time without eating. So you need to have beta oxidation, especially for the heart that relies on beta oxidation a lot, and the brain. These are high energy tissues, okay? And those fatty cells will send out the fats, and your cells will take them up, and they'll shuttle the fats into the mitochondria, where this beta oxidation works to break the fat down into energy, okay? And if this process is blocked because these phthalates, well, your heart and your brain are not getting enough energy, okay? So bad news. And last thing it interferes with is it interferes with the making of a product called let me just look in my document. Oh, sorry guys. Okay, alpha hydroxybutyrate levels, okay? And it inhibits these being made, and these are ketones. And ketones are super important for people that are in any kind of fasting state, and they also have been shown to calm the brain because they can go right up in there. That needs no shuttle. But if you have phthalates, you can't make these ketones, which a lot of people want to be on a keto diet nowadays. You absolutely cannot do a ketone diet and feel well if you cannot do beta oxidation, okay? So that we need to check. If you have tried a keto diet and you had these flu-like symptoms the whole time, you definitely would benefit from getting this testing done so we can see what your phthalate levels are and how to get rid of them, you know. Alright guys, so that's basically all this video is about. I do want you to check out the video on phthalates to show how you don't expose yourself to so many. But yeah guys, that's all this video is about. Please consider subscribing. I am a naturopathic doctor. There's only 8,000 of us practicing in the United States. We are physicians, but we're natural medicine experts. So you'll get a new lens looking at health issues, okay? And I love you guys, and I really, really hope that you have a good rest of your day. And give me a thumbs up if you learned something new, okay? Okay, bye.